Thank you all for being here. We're going to just get this thing started just a few minutes early so that we can remain on time and be respectful of everybody's time. My name is Kevin Lang. I'm an assistant professor in the Veterinary and Biomedical Sciences department here at the vet school. And just full disclosure, I did next to nothing in organizing this day or the events of this day. So I don't want to stand up here and take any credit. But I do want to thank the folks in the special events subcommittee of the research committee for doing some organizing of this event. I did also want to say that the RIDE seminar series, when I started organizing it, it really needed an injection of energy. And we got that injection of energy with Alonso taking over, and he was really behind it all and pushing us to get it started. So I'd like to just thank Alonso and the team that he has in the research office. Shannon, Jessica, and Kinsey, and Tibber. All those folks are working really hard, not just doing pre-award, but also helping organize this kind of thing today, and also the RIDE seminar series. So just a few logistical things, and then I'm going to hand off the microphone. If you are here and would like continuing education credit, CE credit for today's stuff, there's a sign-up sheet in the back, so make sure you put your name on it if you're interested in CE credit. As far as the RIDE seminar series, there will not be a seminar in August. It's a much-needed break in the organization committee, so we're taking August off. But next year's lineup of speakers is already set, so please look for emails and other information, and you can also check the website. Everything is there, and so please attend starting back up in September. I'm rotating off the research committee, so I am no longer going to be organizing or hosting these events, but next year, for the time being, Amy Kinsley and Caitlin Fyoke are going to take over, and so you'll see them. And if you have an idea for a seminar speaker for the future, please reach out to them. They're always happy to take some feedback. And with that, I'm done. I would just like to pass the microphone off to Dr. Lulich, and he's going to introduce our speaker.
Thank you, Kevin. I appreciate that. I think before I get started, I'm just going to make sure the computer's still up and on. That's really good. Great. Well, I have the opportunity of introducing Dr. Joe Bartges, and I guess what I put up there is, he's at Georgia, but before he went to Georgia, he actually had a stint here at the University of Minnesota, which was really good. So when he came here, was it 87? He came in 87 as an intern, and at the time I was a resident, so I knew Joe very well. What was nice is that he cooperated with us. You may not realize that behind all this toilet paper, because we were celebrating someone's wedding, and as a tradition, what they do is they dress you up in a wedding gown made of toilet paper. But there's Joe right there. I think he needs a new designer. At least he would be on my side. But as you would expect, he needed lots of alterations and changing, right? So he did a wonderful job. I think the big thing that Joe always remembers about me is that we shared an office together. And all he can remember is that I kicked him out of my office when I became a professor. And I didn't do that at all. I had no idea what was going on. All I know is he was gone and I was relieved. So I enjoy that very much. But what I really want to do is sort of mention the other things about Joe Bartges. We did work together. We both work with stones and urinary tract diseases and kidney diseases. And what I really want to share with you is that this is Joe here, is that what you really need to know is that he's a very nice, considerate, collaborative person who always makes you laugh and smile and is always free with his knowledge as well as his wisdom. So with no further ado, I want to say that Joe Bartges is a distinguished veterinarian, educator, and researcher whose career beautifully bridges the worlds of clinical practice and scientific discovery. If you can give me a nice warm welcome, we will welcome Joe Bartges.
Yeah, you did put me out.
Don't forget to turn on your mic.
I will.
Okay.
I didn't want to say what I was going to say to you.
Uh-oh. 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 Oh, let's hope not.
Okay, well, thank you for that warm and nearly accurate introduction. I'm sure he was glad I was out of the office. He did actually throw me out. I don't care what he says. I got thrown into a closet. It was where the Xerox machine was, and it was this big. And my desk was there, and my back was to the door. That's how Jody treats you when you share an office with him. So I have like 2 hours of talks, and it's going to take me like 2 hours. No, so there are a couple of things today. First of all, thank you very much. What I've attended today, especially the first section, was really interesting, really good. And it's kind of funny, I was telling Dr. Brown that there's some things that you'll see again. And so when I was asked what to talk about, I was asked to talk about basically your journey as a clinician, scientist, how you got there, and how you try and motivate current and future researchers. Thanks. Like, no stress. So I will say this is the title I came up with because I'm a big classic rock and roller fan. So you will see things. Hopefully you will recognize some of the titles. The top part, Livin, Lovin, Learnin, is sort of a mash between a Journey song and a Led Zeppelin song. What a long, strange trip it's been. Kevin recognized that one right away because anybody know who that is? The old people will. Only the old farts. So it's a Grateful Dead song, which is perfect because, it's perfect because there's a lot of resemblance. I want to start, not doing what I want to, I'm going to start by thanking the 4 friends who nominated me for this award, Dr. Brown, Churchill, Farrow, and Woolwich. Also to Dr. Geddes and their team, especially Kinsey, for setting all of this up. I am honored to receive this award. I am humbled to receive this award. And it is not an award that actually should go to one person. Whatever you do, it's a collaborative effort. And so there are so many people who, which I will show you, that had an influence, that I worked with, that I know, that I taught, that I, whatever it may be. And so this is not, it's sort of like, how do pitchers win the MVP of the the World Series? Like, they only pitched 2 games, and yet they won. So that's what this is like to me. So I thought I would do is take you on a little journey, sort of a story. And I didn't know what to do, so it's an intro, retro, prospective journey. So we're going to cover all of those. And so we're going to start with the prologue. You have to be a good prog rocker, classic progressive rock person to know who made this song. And then there was silence because most of the people in this audience were not born. So this is a song by Emerson, Lake and Palmer, who was one of my favorite groups. I am from West by God, stand up and shout it when you say it, Virginia. No, I do not know your cousin in Richmond. Born, bred, and raised in Charleston. This is the Bartges Manor. I am a true hillbilly because I grew up in a holler by a creek. And there they are. My dad was a veteran and became a school teacher, high school teacher, and you think wages are bad. His first year in 1953, he got paid $2,300 a year to teach high school. That's my mother as well when they got married. I have an older sister, Lynn, who's on the left, and a younger brother, Richard, in the middle. Again, this was from 1965, so I was like all of 3 or 64, like all of 3 years old then. Skip the early years, but I am a graduate of Marshall University. Oh, there we go. You are a Marshall University person? When? 2019. Oh, go Herd. I was there, however, long before you. In fact, I was there about 9 years after the plane crash. I was there from 1979 to 1983. And I had a really good time at Marshall. I went to Marshall to do counseling and social work. It's a liberal arts school. It is, at the time, I only had about 8,000 students. West Virginia University is the land-grant school, but Marshall is the University of West Virginia. And I was in a fraternity, was president of the fraternity. I started playing in bars. I enjoyed playing in bars so much that I could have graduated after 3 years, but took the 4th year to enjoy college. And also to decide when I hit my 3rd year, like, I have to do something when I graduate, and so what am I gonna do? So I started taking things seriously. I was playing music in bars like 4 nights a week for 2 years. And so there we are, the group. If you've seen the movie with Matthew McConaughey, I get mistaken for him all the time. It's a curse. I did not want to be a veterinarian. Growing up, I went there to be social work, counseling. I got very interested in science. I loved genetics. And so actually, to make money, and just because my dad was a school teacher, I worked for a veterinarian in Huntington, West Virginia on the weekends, and it turns out Dr. Fallon was actually the first small animal veterinary hospital in the state of West Virginia. And, but that didn't stimulate me to be a veterinarian. My 3rd year, I could have graduated in my 4th year. I could have graduated at the end of my 3rd year. I took graduate courses. I had been accepted to Duke University for a graduate degree in genetics, and so that's what I was going to do. And I was taking the course. There were 3 of us in there. John Ray, the first one, Sandy Elliott on the bottom line, and myself were the 3 students in this advanced physiology course. And that's my first experience with research. And during that, Dr. Kale, who that's the picture of, E.B. Kale, said, "You like animals, you like science. Have you thought about veterinary medicine?" I went, "No." "Well, maybe you ought to think about it." So I applied and got in and changed my direction. Now, life includes professional and personal. And so at the time, I met Carol, and we got married right after I graduated, and then we immediately moved to the University of Georgia, where I went to veterinary school. I was SCAVMA president, the student organization president, among other things. This is Uga 4, the bulldog mascot. I helped take care of him when he was in the hospital. And I was fortunate. There were a lot of people who were very well known. Minnesota and Ohio State and Georgia and UC Davis were sort of the P schools. And Georgia, Del Finco, who actually was a graduate from here, PhD from here, and was at the same time as Carl Osborne, was there. Jeannie Bersani, Craig Green, and then Scott Brown and Mike Lappin were residents. And they were the ones who suggested I should do an internship and a residency. And by the way, if I'm going to do a residency, I should do a PhD. If you're going to do a PhD, you should stay in academics. Which is about the way they presented it. And so I did. And so I applied for internships, and matched with Minnesota was my first choice. And the reason is that they said, you need to do a residency, you need to do a PhD. And at the time, the only places that were doing that combined were NC State and Minnesota. And I had worked with somebody doing plasmapheresis in mares, and he came here as an equine surgeon. And so I went, well, he liked it. I might as well just look at Minnesota. And Carl had, Dell knew Carl. And so I showed up the week before Christmas. At the time, the match program, because that's the week I had off, the match, you had to have all your information in early December. So my rank was already in. It's now way after that. And I can remember exactly, they dropped me off and nobody was there. And the people who were there said, we don't interview, like you're not, like there's nobody here. And so I walked in and I found Dave Polson's office and I talked to Dave, met Carl, met Jody, and I sat down with Bob Hardy and Bob said, why are you here? And I said, because I'm interested in an internship and a residency and a PhD. He goes, yeah, but you've already ranked. And I said, yes, but you haven't. And so I did. end up here. And my intern mates, there were 4 of us at the time. Anne-Marie Christensen's on faculty in Denmark. Bob Roy is a surgeon. She's an internist. Bob Roy is a surgeon. He's probably retired now because surgeons make a crap ton of money in private practice. But he was in Florida, and then Mary Louise Thomas did a dermatology residency. So they kept all 4 of us interns for residencies. And at the time, this was what a lot of the faculty looked like. And I could not find a picture of Anna, because I was trying to put everybody in there. But the faculty at the top, and then all the ones on the bottom were people that were residents around my time. And so it was a good experience. So that was the prologue. Now comes chapter 1 of the story. So I came to Minnesota because I was doing an internship. I wanted to do a residency and stay for residency and PhD. And at the time, there was only 1 residency position open. And Jeff Klausner, who was department head, came to me and said, I think we can get a second position, but you have to work with Carl. It has to be something in urinary. And so I met with Dr. Osborne, and he said, yes, if you want it, it's yours. And so this is great. All right, fine. There were some caveats to it. One is that it was funded by Hills, and so at the time, the College of Nutrition was just being started, the accreditation. And so they wanted a nutrition resident. Well, there weren't nutrition things yet. Bill Olson was here. He was grandfathered in, large animal. And so he was my mentor. I was like the 8th or 9th person to take the exam. That's because they grandfathered in their first group in like 1990 or 1991. Anyway, so I remember this case very well. This is why this picture is so crappy, because it's an old picture. I had this case. In fact, it was when I was an intern. And Larry Adams, who is now retired from Purdue, he was doing a district PhD in chronic kidney disease in cats. And I'm looking at this cat on this table, and I walked out because he was walking by. He was standing in the hallway, and he goes, that cat's got renal failure. He's hypokalemic, which had not been described at the time. It was not in the literature. And I went, yeah, whatever, right? And sure enough, it was a hypokalemic polymyopathic cat. And so when I first started, the idea was going to do a PhD looking at potassium metabolism in chronic kidney disease with Dave Polzin. That fell through. And so Carl came and said, I got an idea. You can do some stone stuff, and we'll factor in the nutrition things. Well, someone had done work on struvite. Someone else was at the same time doing calcium oxalate. And so they said, well, the next most common stone type is urate, and this is the dog that started it all. His name was Chuckles. And Chuckles was intact, because they always are, English bulldog, and he had urate stones. And it was a time that the Hills had come out with prescription diet UD, which was a uremic diet to begin with. It was an ultra-low protein diet designed for dogs were azotemic renal failure, but on their kidney diet, KD, they were still clinical. So it was a more restricted diet. And so they're looking, can we do something with it? And he ended up being donated because it looked horrible. And I'll show you some studies with it. It had casein, so it was this white, rubbery, beige thing that like you could bounce it on the table. It was so gelatinous. And so the owner thought it looked horrible. And so they were trying to dissolve the stones before, and he was dissolving, and then he stopped dissolving, and we removed, and they had xanthine in it, which I'll come back to. And we found out that the owner thought the food looked so bad that she was top dressing it because she thought the dog needed some like real food. And it was SpaghettiOs and meatball. That is actually his urine. That's not orange juice. And so if you know anything about your purine metabolism, purines come from nucleic bases, adenine and guanine. There is a dietary pull that comes in from the purine content, protein content primarily of the diet, and an endogenous turnover because we have cells. And it goes down this terminal pathway. There's some other de novo pathways that come in too, but these are the main ones. And it goes through hypoxanthine to xanthine uric acid to allantoin. And in non-primate mammals, that's the end product. In primates, us, we stop at uric acid. We don't have that enzyme. That's why we get gout, which is uric acid, usually sodium urate precipitations. Uric acid is what lizards and reptiles and birds That's how they get rid of their nitrogen. They're called uricotilic. We get rid of our nitrogen by urea. Well, there are certain breeds of dogs in certain situations where uric acid doesn't get converted to allantoin. So commonly with patients who have portal systemic shunts, congenital vascular liver diseases, right? It's bypassing the liver, which is where metabolism occurs, and so it can't get to the enzyme. And back, I don't know, 100 years ago, Dalmatians were known to have this problem since the 1800s. There are lectures on Dalmatians being models for gout, but they didn't know why. And then somebody figured out it was a liver issue and that it was something to do with, they had uricase in their liver, it just didn't get to it. Well, it wasn't until, I don't know when, Eva probably knows, but 20 years ago maybe, that Banish identified a gene that encodes for a transporter protein. It's a solute carrier protein. And all Dalmatians were homozygous mutated. And all Dalmatians. But then there was this thing, they did a back cross, where they bred it to an English setter, and then they back crossed them. And so now, actually, Dalmatians are two types, high uric acid excretors and low uric acid excretors, which tore apart the Dalmatian Club of America, because they're not purebloods. They have English setter in them. So anyway, so there's this enzyme transporter, and this is actually urine from a Dalmatian, Sullivan. And so they have high levels of uric acid. So at the time, back in the late 80s, there was no really good way to dissolve these. You tried to feed a low-protein diet, and then you'd give them a drug to block the enzymes xanthine oxidase, which is allopurinol, which is handy because it's purines. And so I sat down with Dr. Osborne, who was really good, and he said, so let's come up with some things to do. I was like, well, we got to see what the influence is. So we took normal beagles, and we fed them different diets. So P is PD, it was a pediatric diet, a high-protein diet in blue. The S was struvite diet, SD, which is no longer made, but was designed to dissolve struvite, which actually came out of work done here. KD was stuff that Dave Polzin and Larry Adams did. It was the kidney diet, and then UD was that ultra-low protein diet. And these are their excretions of their uric acid and their ammonia. So there's this diet effect, right? Good. But we also have to use a drug. And so at the time, allopurinol was given twice a day. Like, do you get a benefit of that? And so we did a study again with the beagles, and you get their uric acid levels lower with the drug, but it's at the expense of xanthine going up, which is the compound right before uric acid, because you're blocking that enzyme. And allopurinol is actually converted to an active metabolite, which comes back and blocks it again. And so you've got to restrict dietary protein. So at the time, Jody was doing solubility studies with calcium oxalate. And there's lots of scientific ways to explain this, but this is the way I explain it to veterinarians because this resonates. If you're on the left and you have a shot of tequila, and you put a little salt in it, the sodium and chloride dissociate and dissolve into solution. It becomes soluble. So you can't see it. When you add more salt, you get to the second one where you can see it, right? It's above what's called the solubility product because it's not maintaining solubility, but it's not precipitating either. As you keep coming to the right, you can see it gets cloudier and cloudier until you add enough that it spontaneously precipitates. And that's its simplest way. And you're above what's called the formation product. Now, there are different ways this can occur. One is by lots of minerals in the urine. Others can be it forms around something else. But there are ways to determine this. And so one way is to do something called relative supersaturation. So what you do is you get a timed urine sample, you measure a bunch of stuff in it, you put it in a computer program. There are a couple of the time most people used Equal, which was an equilibration program. And it iteratively goes through this process looking at how these ions interact. And you get what's called an activity product. And all that means is the activity product is how active are the ions with the other ions in solution. It's what's called the effective concentration. So you have sodium. How readily does it combine with chloride, with oxalate, with some other anion? You have oxalate. How readily does it bind with calcium or magnesium or some other cation? And then it's compared to that solubility product. Remember that thing over at the left, where things go into solution or things start becoming oversaturated. And so that's the relativity of it. The other way is to do something called activity product ratios, which Jody had been doing with calcium oxalate. And so what you do is you take that urine sample, you do that, and then you take another part of the urine sample and you put C crystals of the mineral you're interested in, calcium oxalate, or for me it was ammonium urate, sodium urate, uric acid. You incubate it, let it equilibrate, you rerun everything, and you do the ratio before to the ratio after. And so if you think about it, if you have an activity product of 10 before and 10 after, the ratio is 1. And 1 is actually the solubility product. If you put crystals in a solution that is undersaturated, the crystals dissolve. So the post APR will go up, the post one. So now it'd be like 10 over 100. So the APR is like 0.1. And if the urine's oversaturated, you put crystals in, it provides something for them to form around. And so your chemistries go down. And so you get a 10 over 1. Now the ratio is 10. So it's an estimate of how saturated the urine is. The advantage of activity product ratios is that it also takes into account everything you don't measure. Because stones don't form just because there's crystals or minerals. They form because something's not is defective in allowing these crystals to come together. And stones are composed of mostly minerals, but there's this matrix part of it that's like that can be inhibitory stuff, or proteins that can form around. And we don't measure a lot of those things. Our relative saturations don't measure it. APRs do. And so you don't get the same answer. So this is a study we did in healthy cats where we took fed them 4 different diesters or relative supersaturations. You can see they're pretty variable, but here's their activity product ratios for struvite. It's pretty flat because it's taking into account all those things we don't measure. So we went, what the heck? Let's just do it. So we learned how to do this. And so this was a study we did on our beagles. Ultra low protein diet, high protein diet, lo and behold, activity product ratios are lower. Now these are healthy dogs, so they're not that high to begin with. Then our next question was, well, is it the amount of protein or is it the amount of purines? Well, UD was a casein diet. Caseins should be low in purines, milk protein. So we took that and made it a 20% protein diet, and the activity product ratios actually went up. The uric acid levels actually did not go up very much. It was the ammonia and the pH that changed that probably drove it more than anything. And then, is it the type of protein? And so this is a study we did where we had our casein, our base diet, and then we substituted chicken for it, chicken and liver, and then egg. And so it's not only, what we found is you can keep these saturation levels low, it's the amount and type of protein that you use. All right, so that's one half of this problem. The other half is allopurinol. Allopurinol was supposed to be given 3 times a day, but there's nothing in the literature at the time that talked about it. Where did they come up with this dose? And so I, being a unshy graduate student, went, well, I'll find somebody. So called over to the medical school, Ron Sawchuk, who's a pharmacologist over there, started talking to him. He says, here's what you got to do pharmacokinetic studies. I went, okay. Because one thing is you got to get IV allopurinol because you need to look at bioavailability. You could not get IV. There was none. Could even get powdered to make IV. It was made by Burroughs Wellcome. And I did some research. Turns out that a lady by the name of Gertrude Lyon was the one who discovered it. I'll come to her in the next slide. And I called Burroughs Wellcome and I said, hey, can I get some injectable allopurinol? And they said, well, we'll have to talk to her. I said, well, can I talk to her? And they said, no, she's retired. Well, that's unfortunate. He goes, well, we'll call you back. So about a week later, she called me out of retirement. She is a Nobel laureate who received the Nobel Prize for the idea of drug target as the goal, not versus trial and error of what drugs you use. She helped discover the first antiviral drug, the first immunosuppressive drug, the first anti-inflammatory drug, allopurinol, and I'm talking to her on the phone. This 30-year-old nobody. And she was so great. She was like, so tell me about your study. And we were just talking and just talked and talked. She goes, all right, I'll send it to you. Yeah, we did some stuff with dogs. We didn't do any of that. And next thing I know, I got injectable allopurinol. So we did several pharmacokinetic things. What we found out, Larry Felice was here, developed an HPLC method. We could measure allopurinol, oxypurinol, the active metabolite. We did bioavailability, it's about 70%. We found that giving it with food or without food didn't matter. We found that the diet that it was given with didn't matter, which it does in humans. And so what we found is a twice-a-day dose was as effective because of oxypurinol. And it actually decreased the amount of xanthine that we saw. So one thing to keep in mind, a difference to be a difference must make a difference. Even if you have statistical difference, if it doesn't change anything, who cares? I mean, you care because you got a publication and you got positive results. But a difference to be a difference should make a difference. And so what the difference, when I look back is, we could not dissolve these stones. Now we could dissolve about 30% of the time, about a third of the time. The stones became xanthine about a third of the time, and about the other third of the time, they either didn't change in size or they got smaller, and about half of them got smaller, and we could retrieve those without doing surgery. So either with drug and diet or drug and diet and a minimally invasive procedure, we could manage these stones without doing surgery about 50% of the time. Not only that, as the diet got changed, the prevention part of it, the diet alone was effective in about 90% of patients. Whereas if you didn't change the diet, some studies up to 90% recurrence, but this was a shorter term study. It was like 60% over about 3 to 6 months. And then I got involved with other things. If you're smart, you will branch out, diversify. So I had done plasmapheresis, plasma exchange, when I was a student in vet school, and Jeff Klausner had a phoretic machine, and so we started pheresing everything. Everything with immune-mediated diseases. And so this was a publication we got out of. A dog, his name was, Dean Reitzman, his name was, I should know his name. Anyway, he had myasthenia gravis, and we pheresed him down and got over it. He was on steroids, got him off steroids, he did great. And then we had an English Cocker Spaniel who had sterile struvite, and Dave Polson said, we ought to write this up. I had these 2 other ones that are related, and we did a bunch of metabolic studies and just by being there. Now, there's no good time to have children. So my daughter was born in 1989, my son was born in 1993, in the middle of my residency, and that is the absolute worst time to have children. And not only that, when my daughter was 2, she was diagnosed with insulin-dependent diabetes, and my son was born with hyaline membrane disease and a PDA, patent arteriosus. They gave him indomethacin to close it, and he went into oliguric acute renal failure, and they had to get him through that. They're doing fine now. You'll see them later. They're doing good. And before I leave Minnesota, I just want to shout out to the Minnesota Urolith Center, the ones with the halos. There's one person missing on this, is Kathy Bird, but Lisa and the 2 Lauries, there's nothing I can say. They're the best people in the world. So that brings me to chapter 2. Who did this song? Well, it's a little bit newer. REO Speedwagon, good job. So I went to Georgia. I went to Georgia to do nutrition. And I took care of Uga 5 when he was mascot of the year. And he was star of the movie Midnight in the Garden of Good and Evil with John Cusack and Kevin Spacey. And he tried to kill the Auburn player in Auburn, Alabama. I take full credit for all of those. And he was a great dog. My kids used to come in, this is him with them, they would bathe him on football Fridays before home games. He was just phenomenal. And I continued my work with urinary diseases and started doing nutritional diseases. And so we did a study looking at fiber, which took forever to get published because I dropped the ball, but it just got published 20-some years later. So don't give up hope. Anything is publishable if you do it right. And so this actually was a resident's paper. She sat down, she went through everything again, and looking at dietary fiber and its influence on naturally occurring insulin-dependent diabetic dogs, and the amount of fiber didn't make a difference, moderate fiber versus higher fiber. When I went to Georgia, I was doing nutrition stuff. I thought, I got to come up with something nutrition to get funded. And so I went to one of our surgeons, Steve Busberg, and I said, hey, this fish oil stuff is kind of hot right now. I got an idea. What if we pre-feed dogs fish oil before they develop arthritis? And he said, oh, all this fish oil stuff, like we'll never get funding. Like we all know it's got anti-inflammatory, blah, 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 blah. So I went, all right, well, fine. And about 2 weeks later, he came back and said, so I've got $350,000 to do this study. And so we took dogs. There's a model called the Pond-Nuki model where you transect the cranial cruciate ligament. And so we took these dogs and we did synovial biopsies and blood and stuff. And then we cut because I am not a surgeon. He cut randomly one of the cruciates. we followed them for 6 months. Then he went back and repaired the cruciates, and we followed them for a little bit longer. And they were fed, the groups were fed 1 of 3 diets. They were identical except for the omega-3, 6-3 ratio. One was a very high omega-3, a 1-to-1 ratio. One was sort of what you see over the counter, 8 to 10. And then one was a very low omega-3, so 30 to 1. And it turns out that the dogs eating the 1-to-1 had less inflammation, had better weight bearing, and a slower progression of the radiographic osteoarthritis if they were fed it before they were developed osteoarthritis. And at this point, when you repair them, you can't tell them apart. Their lameness looks the same. Actually, they're not lame. But radiographically and force plate analysis, the dogs on the higher end omega-3s actually do better. So what I learned from that is you don't have to prove yourself to anyone. You don't have to prove yourself to yourself, because I went away from that thinking, God, I'm stupid. Like, who came up with this idea? Oh, wait, it was me. And then we did the study, and I was like, that was a pretty good idea. But I was only there for about 3 years. And so I went then to the University of Tennessee. And while I was there, I went in 97. In 2004, or 2003 or so, I made it to full professor, and I applied for and got an endowed chair of research, clinical research, which didn't mean anything other than I had a little extra money to spend, because it didn't pay my salary or anything else. But it was the War Dog Memorial here. And I continued some more stuff in urinary. We did a study looking at cats and did acidification, or I guess, yeah, in cats, did acidification make a difference with how saturated their urines were. So we made 3 diets. The only difference was one induced a pH of about 6.2, one about 6.8, and the other about 7.2. And as predicted, the struvite saturation goes up with high pH, because that's a very common thing. But what we also found is the calcium oxalate went down in black with higher pH. We also looked at bone density and some other things that didn't really change bone density. This was a year-long project. Did collaborative research. Jody, we did, at the time it was XD, and these were cats who had naturally occurring stones, and he collected samples when they were eating the diet on which they formed the stones, and then we switched them to this, was at the time a prototype diet for oxalate prevention, and we were running all the chemistries. So here's when they were on their stone-forming diets, their relative saturations and APRs, and the preventative diet lowered it statistically. In fact, we did with other things. At the time, one of the zoos in Missouri, St. Louis, who called me and said, we have giraffes and they're forming calcium oxalate stones. And like, do you know why? And I went, no. And said, well, can you do that stuff you do? And I went, can you catheterize a giraffe? And how big a ladder do you need? But so we figured out a way to collect it off the ground. So they had 2 giraffes who didn't form stones and 1 giraffe who did. And this is our relative saturations. So you see they're low in the non-stone formers, but they're high in the stone formers. And what we found out is we started feeding them different leaves and stuff, and there were certain leaves that increased the oxalate excretion, and so with that we were able to figure out which foliage they could eat that would not increase their risk. And I had started with graduate students by then. Actually, I started at Georgia, but I was doing both nutrition and urinary. I started the nutrition service when I went to Tennessee. Claudia Kirk, who worked for Hills at the time, came and joined us on faculty. We continued it, and then as we trained residents, they took it over. Angie Lusby, her name now is Rollins, now runs it. And Mary Ann Murphy, who was one of my residents who did some work with vitamin D, are both nutritionists there. And then when I was meeting with people yesterday, it was like, and he does some biome work. And I'm like, I do it, but not like well. Because like once you get like kingdom, family, class, order, family, genus, species, and you go, lots of bars, lots of colors. What does all that mean? And then they do all these plots. But I had, at the time, there was an article that came out actually at the medical school here at Minnesota that dogs were reservoirs for bacteria that cause urinary tract infections in women. This is a great graduate project because what they did, this poor graduate student, is they wandered the streets of Minneapolis and St. Paul and picked up dog poop and then compared it to women who were coming into the urinary tract infection clinic. And they were sequenced like, look, the dogs have it just like women do, and they're very similar. And so dogs must be giving it. Actually, giving it to the people. He actually found out and published later, no, it's probably more the other way around. And actually what we found with her is with Kate Stensky, who's not her married name now, she's on faculty at Kansas State, we took owners, women and dog pairs, and then women who did not have urinary tract infections but didn't own dogs, and then women who had urinary tract infections and didn't own dogs. And we looked at their E. coli and their feces, and what we found sort of interesting is the dog-human pairs had identical E. colis for the most part. Urovenous factors and antimicrobial susceptibility. The women who were the controls and the women with UTIs, their E. colis were more drug resistant rather than the ones who had dogs in the household. Go figure. And this is Dr. Don Lowe. He was actually one of the first faculty hired here at the University of Minnesota when the veterinary school opened. He trained Carl Osborne and Del Finkel, among others. And as far as I know, this is a correct quote. He said something to the effect of, we must practice 30 to 40 years of medicine, not 1 year 30 to 40 times. So as I was going through my career, it's very easy to I can treat a diabetic and I can scope an intestine and stop. But in the early 2000s, oh, it didn't play. In the early 2000s, that's funny, it played before. John Kruger, I was at ACVIM, and he said, you got to get a laser. And I went, all right, I'm going to get me a laser. Oh, it's not going to play, shoot. Anyway, so I started doing laser lithotripsy, and started doing ectopic ureters. We started doing urethral bulking for incontinence. We did a controlled study with a silicon-based product that actually came out of a company that was based here in Minnesota. We started placing urethral stents, ureteral stents, tracheal stents. Started doing vascular things, cardiology and I. And so we're doing intrahepatic shunts, where you place a stent in the vena cava over the opening of the shunt inside the liver, and then you drop these thrombogenic coils across the stent into it to close it off. So, continue to practice. And if you're not a veterinarian, continue to do research and grow in what you're doing. Don't get stagnant. I was involved with other things because I was doing these procedures. I was involved with some studies looking at a fluorescing antibody that bound to COX-2 in carcinomas, both in oral and in urothelial cell carcinomas in dogs. This doesn't show up quite as well, but these are bound to the COX-2s. And we were doing, before it was called it, precision medicine. We would biopsy these dogs. I would scope and biopsy these dogs. She would grow them up. She was a molecular biologist, and would grow them up in cell culture and incubate them with different drugs. And they would tailor the drug protocol to what the in vitro response was. Interestingly, about 10% of the dogs did not express COX-2, because we think about giving a non-steroidal to all these dogs. But there's about 1 out of 10, at least in her studies, that didn't express the receptor that would benefit. Now, in the middle of all this, and I'll do my best to get through this, life is what happens when you're busy making plans. And somebody alluded to that this morning, but this is actually from a John Lennon song. So, in 2004, Carol was diagnosed with metastatic malignant breast cancer. And after aggressive treatment, she died about 2 years later. You know, this morning, on the table, she was talking about when her daughter died. Time stands still, but life goes on. So it took a while to recover, but a few years later, I happened to meet now my wife, second, Donna Raditic, who's a boarded nutritionist, a veterinarian. And during that time, I got my daughter through high school to college, got my son from middle school to high school, and eventually to college. And then, because that wasn't enough, I became an interim department head. I remember Carl Osborne saying, if you want to kill your career, be an administrator. The dean at the time, Jim Thompson, said, this will only be for 6 months. Everybody wants to be a department head. I went, I don't, but all right, I'll do it. I felt an obligation. And so one of my neighbors, who was a clinical pathologist there, caught me at the grocery store, buying beer, and is like, you are going to need so much more. And what's different is, at the time, the department head at Tennessee was also the hospital director for the small animal hospital. So I suddenly went from barely bouncing my checkbook to managing a $20 million budget with hundreds of employees. Department head is the toilet of the world. All crap flows through it, from above, up, and from the administration down, you are the septic tank. I'm sorry, that's just the way it is. And after 3.5 years of being an interim department head, at which time I still taught all my courses, still had all my graduate students, still did all my clinics because they would not hire locums to cover my time, I decided I need something different, because one thing I also learned is you cannot not unknow what you learn. All right, who's saying this? You should know this. Dylan, of course. I decided I need something totally different. And so I took a position in Cornell University Veterinary Specialist, which is a referral practice that Cornell owns, but it's in Stamford, Connecticut. And I had an appointment, adjunctive position at Cornell, and so I was going back and forth to Ithaca, which is like 30 minutes as the crow flies, but 5 hours by car because like the roads. My technician, Amanda, and her partner, Jamie, went with us to the practice. This is Donna, we're in New York City here. And if I could hire her again, I'd hire her in a heartbeat. If you go into practice, you're a veterinarian, or if you're doing research, hire the best people to do your work for you and get out of their way. That's my advice. And what was funny is at the time, here's me talking to the client. That's not the client. She's sitting up here on the chair. So somebody took this picture, and I was talking at a New York State Veterinary Medical Association meeting, and I made some offhand comment about like, geez, there's a lot of bulldogs up here. Like, I'm from Georgia. Like, I can't believe all these bulldogs. And this guy came up to me and he said, "You were kidding, right?" And I went, "No, like all these bulldogs." He goes, "You know Yale is just up the road, right?" And I went, "Yeah." And he goes, "You know Yale's the Bulldogs." And I went, "They play football? It's the Ivy League, right?" I'm from the SEC, and like there's nothing else. So I was there for about 3 years, and some of the things they promised didn't quite come through. My advice, if you go into practice or you sign a contract, make sure you read all the fine print, because they find ways to get around it. So who's saying this? John Denver, and I put this up because it also mentions West Virginia. And so I ended up in 2016 back at the University of Georgia. And this is Don and I with Harry Dog, who is the human mascot. This is no longer our new teaching hospital. It's now 10 years old. This is the small animal side of it. And I was on during the week of internal medicine forum this week, and so it was just me with a first-year resident, a specialty intern, and I don't see our intern. He must not be in there, with these students. And they decided every Friday is red and black Friday at Georgia. I'm sure you couldn't tell that. And so they all did dress like Joe Bartges Day. And so they did. And then she went out and got a beard. So she became my doppelganger. And she stayed for her residency. And so we are still doing things with urinary diseases. We've been looking at, and remember that range between the solubility product and the formation product is a state called the metastable range. And it sort of struggles to maintain the stability of things in solution, right? It's like you saw the cloudiness of it. Those aren't stagnant. They're moving in and out as they associate and disassociate. And so we did a study, a small study, looking at Bichons with matched non-stone forming Bichons. And so the stone formers are in black. So their relative saturations are higher than the non-stone formers. And what's interesting is their upper limit of metastability is lower than the non-stone formers. That's really high. And what's been published by Abigail Stevenson is an upper limit of metastability about 10 is where they're prone to forming stones. So that was sort of interesting. This should make Dr. Furrow happy because since I started doing activity product ratios, when I went to Tennessee, I was working with the toxicology lab, and the person there is the best lab rat I've ever worked with. You give her something to do. If she can't make a technique work, it can't be done. And so she set up a urine metabolism lab, basically. And we have been doing relative supersaturations for mainly pet food companies, but studies as well, since like the late 1990s. I have so much data, hundreds of thousands of data points. And so these are only about 500. And so this is just over 2 years, not even 2 years, about a year and a half. And so what's interesting is calcium oxalate relative saturation is very influenced by the calcium excretion, and the calcium creatinine ratio mimics that as well. And we still like to do, and I still like to do a lot of interventional radiology. We have a brand new, now it'll be 2 years old in August, interventional radiology suite with a ceiling-mounted C-arm. Beautiful and very good. This is our first patient. This is our first patient actually who did, and that's her actually on the table. Her name was Lady Austin. She came down from Memphis. She had an intrahepatic shunt, and this is her July 4th get up for this year. The owner sends me holiday pictures. I have Valentine's and Halloween and St. Patrick's Day and every holiday. Holidays I didn't even know existed. Somehow she found outfits for. What we're interested in now is looking at the influence of how food is processed in health and disease. And so if you are familiar with this, there's a system, there's several, but one that most people use is called the NOVA classification of food. And there are basically 4 categories in it. The unprocessed or minimally processed are, as I said, so it'd be like an ear of corn that you pull off the stalk or you boil it and you eat it, the cob, right away. The culinary processed ones are things that you extract from, but they're not meant to be eaten by themselves. So that's butter and oil. So if you made the corn and made corn oil. And then processed foods, you take that whole ingredient and you process a little bit, but it's not put through a lot of, or any chemical, heat, thermal processing. So it's like taking the corn, taking it off the cob, maybe boiling or steaming it, and then canning it, right? Because that processing increased shelf lives, increased stability, has an antibacterial effect, antimicrobial effect. And so that would be what processed food. But now attention has been given to what are called ultra-processed foods, which is a very contentious term, not especially in veterinary medicine, but in human nutrition as well, and the United States. In Brazil and European countries, it is not that controversial. But ultra-processed foods are basically, you take your unprocessed food, you process it, you extract parts of it, you chemically do something with it, you recombine it, you reprocess it, and it's just process, right? So it's like taking our corn and then grinding it out, pulling out some flour from it, cooking it, dehydrating it, using that flour to make corn chips. And what's been shown is that, one, the United States eats the most ultra-processed foods. About 70% of humans in the US eat ultra-processed foods. And obesity, the most common nutritional disease in the world, 60-70% of adults in the United States are overweight or obese. Coincidence? But when you look at what diseases are associated with ultra-processed foods, they are almost identical to what's found with obesity. Metabolic syndrome, hypertension, osteoarthritis, inflammatory diseases, cancer, neurodegenerative diseases, they're very similar. And actually it's been shown, there have been about 1,500 meta-analyses done. There's been like 30, 40,000 peer-reviewed publications in the last few years. That if 10% or more of your caloric intake is ultra-processed food, it increases your all-cause mortality by 14%. And that is a conservative average based on those meta-analyses. So who cares? Well, you care because you're a human. But why do we care? Well, if you look at pet food, canned food, which undergoes what's called retort, and dry food, which undergoes extrusion, is I start with corn, and then I take out corn gluten meal, and corn byproduct meal, and dehydrated chicken, and I cook that, and then I process it some more, and then I cook that into a dough, and then I push it through an extruder, and I cut it into shapes, and I spray palletants on it, and I add chemicals to it so that it doesn't cake, anti-caking stuff. Canned food's the same. The controversy is those could be considered ultra-processed foods. In our opinion, they are ultra-processed foods. When you look at the list of diseases that are associated with ultra-processed foods in humans, they are very similar to what we see in dogs and cats. In fact, we said this once, this is a reason why I will tell publicly, I do not get invited by pet food companies to speak at meetings, to go to their special conferences, they fly people in from all over the world, and I don't really have any funding from pet food companies now in a long time. Because if you're familiar with the Purina Lifetime study, where they took related Labradors and they figured out how much they're eating, they underfed about 25%, not underfed, but they fed 25% less food to one group, and that group that were lean lived about 1.8 years longer than the ones who became overweight or obese. When you go into that data, those data. When you go into those data, these dogs have metabolic syndrome. Their glucoses are higher, their insulins are higher, their triglycerides are higher, they have more osteoarthritis, all the things that you see. And so once at a very large meeting, I said, one could look at this and say it isn't the calories, it's the fact that they're eating 25% less ultra-processed dry food. Yeah, that went over well. So one of my graduate students, Siobhan Bridglesing, who's on faculty at the University of West Indies, we did a study where we took 4 diets that are similar in composition but processed differently: a canned food, a dry food, an air-dry food, and a minimally processed food, because it's really not a raw food. And we looked at 2 different what are called advanced glycation end products, which are compounds that come from the processing. They're produced endogenously as well. So hemoglobin A1C in diabetics, or fructosamine, those are glycation products. And so what's called the Maillard reaction is what occurs in food, and you get these advanced glycation end products. There's a ton of them, and there's intermediates as well. So these are just 2, and the reason only 2 are usually used is because those are the only ones at the time you could get standards for. And so what we showed is that they contained the least processed food had the least amount of advanced glycation end products, and the plasma levels were the least as well. Now you might say, well, why isn't the air dried lower? Turns out, unbeknownst to us, that the person who formulated the diets for us, and we were going through it, the air dry food, what they do is they add a bacterial organism called Pediococcus to it to keep infection contamination down. To get the bacteria to thrive, they add fructose to it. And advanced glycation end products are a reaction between amino acids, especially arginine, and reducing sugars, and lo and behold, fructose is a reducing sugar. And so that sort of screwed that up. About 3 weeks ago, had another graduate student finish. We are working with Art Edison, who is an eminent scholar in the University of Georgia system, is a metabolomics expert. And so we've been doing metabolomic studies. And so one of the things she started looking at is, can you find advanced glycation products on the metabolomic NMR spectra? But we also know there were no standard way of collecting samples. There's none. Nobody does it consistently, even in humans. And so we did studies looking at how do you collect urine, how do you collect plasma, when do you have to freeze it, how long can it sit at room temperature or refrigeration? And so, in fact, this morning when someone said the most important things are relationships, and I think someone else said something about to the effect of, when you talk, don't talk science to people. Like, you need to talk to them as people. Right before I came, actually when I was on the road, there was a donor who has pit bulls, and I took care of one of her dogs, and I called her up and went through our development office, which was phenomenal. We set up a meeting. I talked to her by phone and said, hey, I've got this I had this doctoral student, and we want to keep her as postdoc to keep doing these studies. She went, how much do you need? I said, how much do you want to give? And she goes, well, tell me how much you want to start first. And I went, well, I could do 5 years for like $750 to $1 million. She goes, how about if I give you 4? I went, it works for me. And so she wrote a check for $400,000 this week to the development for her. Oh, don't clap, because that isn't development. Then you can clap. Because development, I have gotten so much funding by going to donors and working in our development office and saying, like, hey, I got this idea. Hey, there's so-and-so, and can I meet them? We have access. Well, we'll see. So here's the epilogue. Circle game. You know who wrote that? As I'm almost over. 5 minutes left. Do what? Old, one of the best female artists ever. No, close. Joni Mitchell. So these are things that I have been interested in and still maintain interest in, both clinically and nutritionally, and we're involved with metabolomics, and I know nothing about metabolomics. I know, pun intended, crap about biome. But I know people who do. And what I do know is, what are the questions, and can you make it happen? It is very easy to come up with all the reasons why something won't work. And most people go straight to that. That'll never work. And whenever somebody says that to me, I say, tell me how it can work. Because I can come up with ways it's not going to work, but I want to know, in your experience and your expertise, how can I make this work? Don't let the negative beat you down. Those are the research that we're involved with right now. A graduate student and a graduate student-to-be. We're doing a lot of advanced glycation end product stuff. We have access to the golden retriever lifetime samples because we classified all of their diets for them. We're going to be doing metabolomics, advanced glycation end products in it, and that's part of the thing that our postdoc's going to do. Because the donor was, wherever it's on here, oh, here it is, was a pit bull rescue person, and I started thinking about this. I went, well, how can I tie pit bulls to this? Turns out, pit bulls have a lot of dermatologic disease. I am not a dermatologist. If it's wet, dried, if it's dry, wet, and everything gives steroids. That's dermatology to me. But I do know they also have mast cell disease. And I do know that advanced glycation end products bind to a certain receptor, and they activate pathways, including the JAK-STAT pathway. Sound familiar? Because you have a drug that blocks the JAK-STAT pathway for atopic dogs. And so I went to dermatology and went, hey, I got this idea. And they went, that'll never. And I went, tell me how it could. And so this is how we pitched the tour. We will do a study with pit bulls comparing non-dermatologic pit bulls that are matched to atopic pit bulls and pit bulls who have had mast cell tumors. And we will get skin biopsies on them and bank them in hopes that she gives us $400,000 more so we can do other things with it to look at what pathways are activated. We also have somebody who does organoid development and research. So we're involved with some of the stuff with her GI stuff, and I talked to her, she goes, yeah, we can do skin. So we're gonna make them into organoids so we can immortalize them and pull them out as needed to do in vitro stuff. Research is easy, the funding is hard. It's a matter of asking the right question to the right people at the right time and smart luck, not dumb luck. Smart luck is opportunity. You don't take advantage of the opportunity, you are dumb. But you make your own luck by seizing the opportunities, by not looking so focused that you don't see the things that are occurring around you. Art is I, science is we. The black lines are all the collaborators that when I was at Tennessee and all the ones that I'm involved with now at Georgia. We have a consortium looking at advanced glycation end products of world-renowned experts. I am not one of those. But they're in Turkey and Netherlands and all over the place. And we are developing assays that can be repeatable and validated. So I've had a pretty good journey from beginning to where I am today. I've had the chance to go to places I never would have gone, and these are only a few. Took advantage of it. More importantly, are the people that I've met, like the relationships. Kevin, there's my guitar. That's one of my guitars. This was a gift to me from one of my clients. He was in the music business. We're still friends. He gave me this Gibson guitar, and I was telling Kevin that I took care of his dog. When he came to pick the dog, he says, I got a present for you because I know you have acoustics, but you don't have electric. And I opened this beat-up case, this beat-up guitar, and take the guitar out, and I took it out of a sheet of paper that says, a Gibson Les Paul Premier, owned by, and overhauled by Wayne Animal Turner, the Hank Williams Jr. Band, and played on the 1999 Rolling Thunder Tour and the Monday Night Football Studio soundtracks. And that is my guitar on the 1999 Rolling Thunder Tour on stage. Oh, and you might recognize Jane Quant, who has been here long enough. She was a resident anesthesia when Jody and I were residents. She's on faculty at Georgia, and then Larry Adams comes down from Purdue since we were all together. So it was the Minnesota reunion here. And sometimes you get to play on Saturday Night Live. No, that's a fake one. This is my doppelganger. But it's pretty good, isn't it? Yeah, when people look at it, they go, really? Well, yeah, you did too. You went, ah. So I'm going to finish up in the last couple of minutes with some words of wisdom. You can decide if they're wise or not. Say what you mean and mean what you say. As a reviewer and editor, I could care less that you think this, whatever you thought you have, is the first thing that's ever been done. It means absolutely nothing. Like, okay, it's a waste of words. If you have never read anything by Lois and Selma DeBakey, you need to read some of their stuff because they were the preeminent medical editors. DeBakey should be a name. Their brother, the DeBakey Institute. They write such good articles about how to write. Think and look outside the box, otherwise you become the Schrodinger cat. You are neither dead or alive creatively, and you are both dead and alive creatively. It was said this morning, it's old term, think outside the box. Always question, especially yourself. Anytime you finish something and you think you're all proud and good, put it down, come back the next day and say, what did I do wrong? What could I have done differently? Was I really right? Stress isn't bad as long as it isn't distress. We have cats, and I get the whole stress fear thing, all that. There is no such thing as stress-free. There's good stress and there's bad stress. It's when the stress is bad that's the problem. Like, why would you teach a cat to not be scared of something that might kill them? Because you don't want them stressed. If you walk out into the road and a car's coming at you and you jump out of the way, that's good stress. You step out onto the road and you freak out because a car's coming at you and it runs you over, that's bad stress. So stress isn't bad, it's just when you let it get out of hand. People don't care that you know until they know that you care. Things that we do, especially as clinicians, but I would tell you even as researchers, everything you do, you should think, where is the humanity or the animal, whatever in this? What's a difference to be a difference must make a difference. How is this going to help something? I'm a big Neil Young fan. On the road of life, right in the gutter, it's a lot more interesting than the middle of the road. You meet more interesting people and you see more interesting things that you never would have. And if anybody knows Tim Minchin, he's another one of my favorites, an actor, composer, comedian. He gave a graduation address, and one of the things, a couple of things he said is, don't have long-term dreams. It's okay to dream. Just don't be so focused on that long-term dream that you forget everything else about you. He recommends that you be micro-ambitious, that you have a passionate dedication in pursuit of the short-term goals. Because if you don't, you will miss all the shiny things that happen in your periphery. All those smart lucks that can occur. Your career is your livelihood. It is not your life. And the best movie of all time, Clarence Odd Body Angel, second class, no one is a failure who has friends. If your career is your life, you will probably have very few of those. You want to live back and say you've really had a wonderful life. So with that, the last, most important thing. My students, when I teach them urology, they have to recite this. And they have to commit it to memory. So, sorry I went over a little bit, but I did it under like 2 hours, so that was actually pretty good. I appreciate your attention, your attendance. I am truly honored and humbled. And these are all the bulldogs I've been involved with. UGA 4 is a student, UGA 5 on faculty. That's my son on the left, and Don and I with UGA 10, who passed away a couple years ago. And now UGA 11 is Boom. I see them twice a year. Great dogs. Any questions, if we have time? Or I've stunned you so much, you're speechless. The mark of a good teacher is that you get asked questions, by the way. I just want to point that out. So you're like ruining my self-esteem here. Well, if not, I am happy. I will stick around. I'm not going anywhere. Oh, I'm sorry. Yes, sir.
Not a medical question. Not a medical question, but being an old Minnesota graduate, is Del Finko still alive?
No, Del passed away. Do you remember? It was after Carl, around 4 or 5 years maybe, I think. He was still down in Athens. His wife Marion's still down there. He still had his cat. He still had his horses too, but he got rid of them. They were raising walking horses, it was probably 2000, maybe 2001, or 2020 or 2021 when he passed away. 20 when? Or 2023. It's amazing that was only that short time ago.
Del was a year ahead of me, and we were all admirers of Don Lowe. Has he gone also?
Yeah, Don's been gone for I don't know how long. I met him when we were residents, but I think he died in the 90s, maybe? I don't know if any of the PE people here know, or anybody back then. Great guy. He was at UC Davis at the time. And Carl passed, what, about 10 years ago? I'm old enough now that time doesn't matter, so I can't, yesterday or 40 years ago, it doesn't make a difference. It's not the years, it's the mileage. And so, yeah, but Scott Brown is still around, although he's retired. But the legacy lives on through people like Jody. And I mean, when you look at the pedigree, as it were, the tree of the P people, George Lease at Texas A&M, and John Kruger and Larry, Jody, it's amazing. Any other?
I have a question. So after hearing the things this morning and things like that, I mean, I do something a little bit different. I'm just wondering if you think about it. Do you ever write a personal mission statement?
Yes.
Okay, yeah.
So yeah, I have one. And in fact, I mean, now being tenured, we go through a post-tenure review every 5 years. But when I go through that, I have a personal mission statement. And every year I give a personal mission statement, like, here's what I want to accomplish. Here's what my mission is for the next year. Here's what I accomplished. Here's what I want to. And then every 5 years, we turn into teaching, research, a clinical, and then a personal mission assessment.
I have one too, but I don't do it every year.
I don't do it every year, but every 5, because it's
very stable in my personal mission statement.
yeah. Huh. If it's not distressful, you don't change. Discomfort is the reason for change. If you're comfortable, you won't change.
Hi, a quick question. You obviously long career, very accomplished, done lots of things. What can you tell us about this thing about work-life balance?
So, work-life balance. Work-life balance is different to everybody. Unfortunately, when it gets pulled into conversations like our work-life balance, it typically means I only want to work 9 to 5. The people who yell, in my experience, especially being in this department, the people who want to talk about work-life balance are the ones who only want to work 9 to 5, versus what work-life balance is to somebody else. For me, I'm a morning person. I get up before 5. I do a couple hours worth of work. I'm usually in bed by 9. And now on Central Time, it's really screwed me up. But it's my work-life balance now in academics is better than it was in practice, even though I only work 4 days a week. Because I am doing the things I want to do. So if you love what you do, your job is never work. And it's just, if other people, that isn't what they want, that's fine. I think if I were ever, which I will never again, be an administrator, what I'd want to know is, what is your idea of a work-life balance, and can I make it fit into the context of what the requirements are to run a hospital, a college, a department, a curriculum, things like that. I am a big proponent of people saying, I only want to work 4 days. Fine, let's come up with a way for you to do a 4-day week, as long as we can make it fit into what we're allowed to do. Many universities don't like that, but they do it in practice. I mean, in the private sector, it's like, why are we so stupid in academics that we can't do what works in so many others? Sorry, I didn't mean to put you on the spot on that one. Especially with other administrators here. But I don't work here, so I don't care. To me, work-life balance really is an individual thing. And I had applied for and had been offered department head positions before I went to Georgia. And that always came up. So what's your idea of work-life balance? You tell me what your work-life balance is. If your work-life balance is, I only want to work 2 hours a day for 3 days, that ain't going to work. If your work-life balance is, I could do this as long as I could have that. I could work 6 to 3, but my kids come home from school, so I want to be home. Let's figure out how we can make that happen. It's a term that gets overused, but means more. To me, it means more than what people use it to mean, if that makes sense.
Okay, let's thank our speaker one last time.
Thank you again.